you.
Good morning, everyone, and welcome to this session of World Water Week 2021. Salam alaikum, buenos días a todos y bienvenidos a esta sesión de la Semana Mundial del Agua 2021. Esta sesión se realizará en inglés, pero cuenta con traducción en español y árabe, así que si quieren escuchar la versión traducida, por favor descarguen la aplicación Interaction siguiendo las instrucciones que encontrarán en el chat. This session will be held in English, but Spanish and Arabic translations are also available. I would have liked to say this in Arabic, but unfortunately, I don't want to put you through this pain. To listen to the session in one of these languages, please download the app Interaction and follow the instructions that you will find in the chat. And having said this, I welcome you to the session Strengthening WASH Services for Safe Return to Schools. As you all know, the world has gone through an unprecedented situation since the start of the COVID-19 pandemic, late in 2019. Since then, many of our behaviors have changed, and elements like wearing a mask, keeping social distance, and washing our hands regularly are part of our day-to-day life. As we know more about the virus and vaccinations are made available around the globe, countries that once decided to close schools as a precautionary measure to limit the spread of the virus are now embarking in the reopening process. So the questions that now become of the utmost importance are how to reopen safely when you lack one of the most fundamental assets to help you stop the infection, like water and soap. How to ensure safety for girls and boys when schools still lack hand washing facilities, or if they have them, they are not fully operational. What about sanitizing products? How to ensure schools are well equipped? These and other questions will be discussed today in our session. My name is Isabel Alvarez, and I am a program officer in the Department of Water and Sanitation at the Stockholm International Water Institute. Today's session is organized by UNICEF and the Stockholm International Water Institute, and it has been designed as a journey, one in which we will zoom in from a global perspective presented by Irene Amongue to the regional perspectives of the Latin America and the Caribbean presented by Alban Novelon, and the Middle East and North Africa regions presented by Esmail Abrahim, to land our final steps in Paraguay and Iraq hand in hand with Rafael Obregon and Hussein Al-Azawi. If you have any questions or comments, please use the Pathable chat and share them with the speakers. I also remind all of our speakers that since our time is limited, I will interrupt and remind them when you have 1 minute left in your intervention. I apologize for this. So please take a seat, fasten your seatbelts, and enjoy the journey. First of all, let me introduce you to our first speaker, Irene Amongue, who is a WASH specialist at UNICEF-based New York City, leading and managing UNICEF's global WASH in schools and WASH in healthcare facilities. Irene, the floor is yours. Irene, can you hear us?
Thank you so much, Isabella.
Okay, go ahead.
Yes, thank you for the introductions. So I'll straight away go to the GMP data for WASH in schools. So maybe you go straight to the slides. Yes, so first of all, thank you. Go to the next slide. No, can you go back to the first slide, the GMP, I mean the SDG. Yes, thank you. So most of you, good morning, everyone. Good afternoon, good evening, first of all. I'm so excited to be with you here on this platform to talk about safe school reopening. So before we go to the details, I just want to let you know that I'll take you through the latest GMP data for WASH in schools, but also share some of our insights and experiences in terms of some of the challenges we know that have impacted WASH in schools services. So on this slide, you can see, maybe to start with, you can see the SDG targets, which relate to WASH in schools. We have SDG target 6.1 and 6.2, which which envision universal access to WASH in schools, and SDG target 4A1, which is about safe and effective learning environments for schools, where WASH in schools falls. Next. Next. So on this screen, you can see the latest data for WASH in schools. So this data was collected in 2019 and updated in 2020. So here you can see the updates, the latest data on WASH, on water globally. So here you can see that 120 schools had estimates to estimate basic substance for WASH in schools. And out of these 120 countries, only 69% had a basic drinking water service. And the rest of the 31% meant that 584 million children lacked a basic service at school. Next. So here you can see the global coverage for WASH in schools, for basic services globally by region, but also by country. And you can see on your extreme left that Sub-Saharan Africa had more than half of schools without a basic service level. But as you move further to your right, the basic service coverage improves. And further to the right, you can see Europe and Northern America. Most of the countries had 100% coverage of basic services. Next. So this is sanitation, and for sanitation, we had 117 countries provide data. And out of the 117 countries, only 63% had a basic service level, leaving 698 million children without a basic service level. Next. So similar to water, you have the global coverage for sanitation, and you can see it by region and by country. Again, like water, sanitation services for Africa, we're really lacking. More than half of the countries did not have a basic service level. But as you move to other regions like Northern Africa, Central Asia, and Northern America and Europe, most of the countries had a basic sanitation service. Next. So in terms of hand hygiene, 110 countries provided data, and out of these, 57 had a basic, sorry, there's a mistake here, but this is basic hygiene service, leaving 818 million children without a basic hygiene service. Next. Again, here you can see the coverage in terms of basic hygiene services in schools. Again, Sub-Saharan Africa had very few countries with basic sanitation, hygiene services. And some of the countries where you see shaded gray didn't have data at all to estimate basic hygiene services. Again, as you move further to the right, Latin America, Europe, and Northern America had basic services more than Sub-Saharan Africa and Central and Southern Asia. Next. So that was it for the latest JMP data for WASH in schools. And here I would like to go through very quickly on some of the impacts that COVID has brought to WASH in schools programming. Next. So you might know that even during COVID, there were some schools that were open, and so there were minimal school operations in some of the countries. And so this data you see here is from some of the UNICEF countries where we work. And so we had about 69 countries reporting some minimal operations. Even though some schools were closed, there were still some activities going on. And you can see that some of the schools reported, some of the countries reported supporting ministries of education to develop protocols, standards, and national packages for WASH in school services. and we had about 405,000 schools and preschools supported with infection prevention and control measures on COVID in terms of providing cleaning services, but also education and IC materials. And we had 13,000 schools in 23 countries that were supported to respond to COVID in terms of providing WASH services, in terms of hardware, but also training and rehabilitation of some of the infrastructure that had broken down. And we had
Irene, you have 1 minute.
Oh, okay, go next. Go to the next screen then. So again, this is some of the data we have in terms of what countries did to improve school health. Next. Next. So just to zoom into some country examples, I wouldn't go so much into this because I know some of my colleagues will go through it. So an example of Vietnam, where the government established decision for 1467 on assessment for IPC in schools, but also provided training to 1,388 teachers. Next. So that was the good part of what happened during COVID, but there is also the bad part. So here you can see some of the bad things or the negative impacts of COVID to washing school services. One of them is really the destruction and of WASH services. Some of the services have been abandoned and not maintained. And also in terms of funding, a lot of countries have been impacted. Most of the countries do not have enough funding and resources to support washing schools. And we all know that because of the movement restrictions, most of the supplies to support washing schools have been delayed or not even provided for some of the schools to operate. And some of our usual washing schools activities like group hand washing have been interrupted and halted because of COVID restrictions. So on the extreme right, you can see on this graph, on this slide, what the funding situation looks like now and what it ought to look like. So this is actually from one of the IRC reports. So you see a lot of a huge financing gap and very little funding coming from taxes, transfers, and tariffs. Next. So here is what we can do about washing schools. Most of you will be familiar with the framework for safe school reopening, which outlines some of the activities in terms of hygiene, MHM, and behavior change that partners and governments can undertake to improve and accelerate WASH in schools. So I'll not go into the details because of the time. Next. So some of the resources that we have for washing schools, some of them were developed before COVID, some of them were developed during COVID. So here we have the framework for school reopening, and we also have a supplement for safe school reopening, as well as the latest GMP report for washing schools that was produced last year. Next. So here is to get involved in washing schools. These are some of the things that the washing schools network engages in. We have the annual meetings like the ILE, as well as the Water and Health Conference at the University of North Carolina. We have the Yama Community of Practice, and recently we developed a washing schools website with partners like Save the Children, GIZ, and WaterAid. So please, you can connect on these platforms to engage further and learn more about washing schools. Thank you very much.
All right, thank you so much, Irene, for providing this perspective on the global challenges and the impact that COVID-19 had on our WASH services in schools. Next, let me introduce you to Ismail Abrahim, the Regional WASH Advisor for the Middle East and North Africa region, who is awaiting us in Amman to tell us more about the situation in this region. Ismail, please go ahead.
Thank you very much, and greeting to you all. If you can hear me clear? Could somebody confirm if you can hear me?
Yes,
okay.
Please go ahead.
Thank you very much, and I'm glad to be with you, and thank you so much for letting me reflect to you on MENA lesson learned on WASH in school during the COVID. So next slide, please. This slide is about actually the pre-COVID situation taken from the 2020 Joint Monitoring Program report, how WASH School in Northern Africa and Western Asia look alike. So you could see that there was the report was indicating that there was a fastest achievement on an annual rate gross across to basic drinking water 2.1 a year, as well as access basic hygiene service to 2.3 for schools all school age. And also all across MENA. Later on, I mean, in the slides, we'll be able to have an idea of the map of MENA. How does it look like? That was from the good side, but there was a disparity exist. The high income countries and low income countries was one of the disparities. Of course, some people are rich; they could be able to cater. And there are, for example, Sudan and Syria have high level of no service at all, and that's due probably to the crisis and ongoing humanitarian issues. Primary school were less likely to have basic hygiene education than secondary school, as per the report was showing there was like a margin of. Next. Next slide, please. Oh, good. On the next slide here, actually, how early we spoke about the washing school, and now we are speaking about the education. How was it look like during the COVID? During the COVID, it was the most impact sector, of course, as you all witnessed. All the 20 MENA countries closed all education institutions for all ages in March 20 when the COVID hit. UNESCO of MENA above global average for weeks of complete, that was a report they published, and partial closure. MENA appeared somehow in the graphs like partial closure of almost around 22 weeks. So that's an indication of the situation, and there was a fear among partners that there will be a kind of a lost generation regarding the learning and the skill across the region. Next. How did UNICEF support the safe return to school? At that time, while UNICEF at the regional office and across the whole countries, they were thinking of, they started with establishing a networking group, and UNICEF played a kind of a coordination to that networking group. And they have worked on the back to school campaign initiated by UNICEF globally. UNICEF played, of course, the core role of the coordination for all the stakeholders and sister agencies to ensure the networking is effective. Not only that, UNICEF held meetings or organized meetings among Ministry of Education in all MENA countries, just to ensure sharing plans, practice, challenges on how they are thinking to safe return to opening school. And of course, among that is a kind of the user guideline and the checklist which has been shared globally, training of teachers on IPC protocols and applying IPC measurements at the schools, and engagement of youth and so on. Within that time, then the WASH sector in the global sort of helping by looking at what was the washing school look like to enable, give more readings to all of them to be strategized on how they handle it. So on the next step, as you can see, UNICEF teamed up with CEST, who's a global partner and very appreciated here in the region, and worked out on publishing a paper. Of course, that was done during that time to get at least an overview of how the situation looked like. So there was a framework design, and the framework was established based on 4 components: enabling environment, hygiene, IPC, and WASH services at the schools. And out of the 20 countries, only 14 countries were picked up where we have WASH programs, because the other 6 countries are the Arabian Gulf rich countries, so that usually during the COVID time, they really have taken care of the services and the situation. So what happened then, the assessment, and I'm sure here you must be now very familiarized with MENA covered countries from Morocco to Iran, and from Egypt north down to Sudan and Djibouti. So the finding was all countries were very active in infection prevention and control, IPC and hygiene promotion, but generally less activity in direct and indirect support to WASH services and enabling environment government is strengthening area. Next.
You have 1 minute, Ismail. Thank
Sure,
you.
done. So the more or less the lesson learned and the learning was like there was a lack of monitoring to the compliance to the IPC and how appropriate, and as well as the hygiene, how effective the hygiene IPC hygiene interventions. Also the use of environment and health clubs at the schools, and support to advocate for renewed attention to the importance of WASH in the schools. I mean, that is what the lesson learned. So the last slide shows that we sought of initiating, last slide please, initiating a TOC to enable us look and be able to dig deep in the situation and to be able to read how does it look like. And it started 2019, updated during the COVID, and looking at the 14 countries from the two kind of areas, the humanitarian and the normal, and see how telling the OIC TOC for multiple countries purposes, and hopefully that will be ready, and thanks to CEST who would be providing these services, and we'll be able also to publish. By the way, the paper is being published on CEST website. You will be able to reach. And my last point is I'd like to thank you very much for giving me opportunity to reflect on the situation of WASH in the school during the COVID in MENA. Thank you very much.
Thank you so much, Ismail, for this overview. And the report you just presented, we'll be posting the link on the chat for those who want to download it. Now, let me take you to Panama, where Alban Nubilon, Regional WASH Advisor for the Latin America and Caribbean region, will tell us more about what has been happening in this region. Alban, please go ahead.
Hello, Isabel. Can you hear me okay?
Yes, we can.
Okay. And I guess you can see me okay too. Okay,
yeah.
Great. Perfect. Thank you so much again for this possibility to interact. And let me, if we can go to the, okay, to this slide. Yep, I think there's the next one. Next one now, please. Yes, this one, exactly. So basically in Latin America and the Caribbean region, we've got an estimated 830,000 primary and secondary schools. And basically this graph shows you the number of school-age children in those schools per service level in water, sanitation, and hygiene. So basically what we can see is that basically there is still a gap in terms of access to data, when you can see all the gray part of the columns, where we don't know if the service is basic or if the service is limited. Then, secondly, what we can also notice is that almost 61 million school-age children in the region lack at least one of the 3 basic water, sanitation, or hygiene services. And basically, from this graph too, we can also almost deduct that the most affected or lagging behind service is the one regarding hygiene, where basically 4 out of 10 school-age children in the region do not have access to basic hand hygiene. So basically they cannot wash their hands with soap and water, which is obviously critical in a COVID response. What we can also notice here from this graph is that basically the number of people, of students not having services in rural areas compared to urban areas are more or less the same numbers. But the fact is that 80% of the people live in urban areas. So there is, in terms of percentage that we don't see in the graph, there is a very important lack of equity between rural and urban areas. And also not shown in this graph, but I would like to comment it, is that the LAC region is one of 7 SDG regions where the sanitation coverage is going backwards. So we have less service coverage on sanitation in schools in 2019 compared to 2015. And also basically mainly due to some, a crisis in the region. Next slide, please. Yes, so out of this graph, what we can see here, and sorry for the background noise, but basically the LAC region is has a less favorable data regarding return to school, where basically 11 out of 20 countries who had most lost school days are from the LAC region. And we also know the impact, the disastrous effect of interruption of schools, where basically the longer children stay out of school and the higher the risk that they will never return to school. And we also know that it has also serious and long-term consequences on economies and societies in terms of increase of inequalities, worsen the health outcomes, also worsen the less social cohesion, etc. If we can go to the next slide, please. So basically, next slide will show us the objective of the study. You've seen from my colleague Ismail for the Middle East, and we've conducted the same study in the LAC region. So basically, the objective were to provide a regional overview of actions taken to ensure access to WASH services for a safe return to school in COVID for these 5 Latin American countries, and also to provide short and medium-term recommendations for this safe return to school, not only for students, but also for teachers and administrative and technical personnel. And also one of the key objectives is the dissemination of the study, of the results, and also to be able to support with CEWE and UNICEF, the countries, the government in the implementation of this recommendation. So let's go to the next slide, please, where we basically see here the monitoring matrix that has been developed by CEWE to basically monitor the countries. So we've got several subcomponents for an enabling environment. We've got 2 components for school hygiene and prevention and control of infections. And also we've got components to measure the WASH services. I think you will be able to deep dive later on. So let's move to the next slide. Thanks. So basically, this what we can see here from the left side graph, the pie graph, is basically that more focus was given by countries, at least these 5 countries, to the enabling environment and to school hygiene and IPC compared to WASH services, where WASH services is at 44%. And in the right hand side graph, we notice that efforts were made to improve WASH infrastructure, but very little was done on the technical assistance side to service providers and also to service provision arrangements. And we know that all these service providers and service provision arrangements are very critical for long-term provision of these services, but they are also more challenging to address. So therefore, they are somehow less addressed in those 5 countries we monitored. On the other hand, we can also see that many actions were conducted regarding infection prevention and control, regarding capacity building, regarding coordination, and all these aspects are also critical too. Can we move to the next slide, please?
You have 1 minute, Alban. Thank you.
Great. Okay, so basically this chart is one of the many analyses that were done for this study, showing the actions carried out by each country. And we invite you to read the full analysis to get the full perspective of the analysis. If we go to the last slide, please. Basically, this slide, we've got short and medium-term recommendations that have been given in the study. But for ease of because they are quite numerous, for ease of presentation, I will just here comment on basically the activities in those 5 countries that were not carried out by countries or just by 1 out of the 5, and that were basically that could probably be the same ones that we could see in other countries that are kind of like lagging behind activities. So we've got in enabling environment, basically not so much support for the adaptation of service models. Also, we also need to improve the supply chain for all the WASH products, and also to make sure that we have a greater availability and continuity of these supplies. We also need to advocate better, more for reliable national and subnational supply chains. Regarding school hygiene and IPC, we need to strengthen the establishment or reactivation of the health clubs or hygiene clubs in schools, conduct participatory hygiene needs assessments by gender and age to make sure that they're representative of the children's and student needs, and girls and boys, and also to ensure to provide equitable access to hygiene products and supplies, again, especially for hygiene management, menstrual hygiene management, sorry. And finally, regarding WASH services, really, we need to create a catalog for available and appropriate technical solutions for service provision, for both water and sanitation, but also to support service providers to expand sanitation coverage, and also to expand the waste management coverage. So with that, I will hand back over to Isabel. Thank you so much.
All right, thank you so much, Alban, for this. Thank you both, Ismail and Alban, for these presentations and these studies. Again, these notes will be available for downloading. You can find the links in the chat. So let me check at this point if we have any questions in our Pathable chat. As you've seen, we will get the questions in Pathable. I see that Aline Ardyani has her hand raised. Maybe you can put your questions on the chat in Pathable. If I don't see any questions yet, we will continue. So I will take you on this journey next to Paraguay, where Dr. Rafael Obregón, UNICEF's country representative in Paraguay since July 2019, is waiting for us in Asunción to tell us more about the situation in the country and what has been done so far to ensure WASH services in schools for a safe reopen. Rafael, adelante.
Thank you, Isabel, and good morning, good afternoon, everyone. Thank you for the opportunity to share the Paraguay experience in this important event. Because of the limited time, I'm going to go straight into the presentation. Next slide, please. Just to provide some context, Paraguay is a country of 7.4 million people, about 1.5 million children in school age, and about 10,221 educational institutions. Next slide, please. Also, in terms of the trajectory of the pandemic and the impact on schools, as you can see, schools were closed throughout 2020. They reopened in March 2021, but only 2 weeks into that reopening, the country faced the greatest peak of the pandemic. The healthcare system collapsed and they went back to full remote learning. And since then, there's been a process of navigating the pandemic, and actually the government decided to give decision-making power to the local districts to decide whether to go back to in-person or hybrid learning based on the epidemiological situation in each district. And as of July of this year, you can see what the situation looks like. But basically, most schools actually remain in hybrid or virtual modality. So that remains a big challenge for the country, even though this may improve, given that there's an increased number of teachers who have been vaccinated. Next slide, please. Just also as part of that context, throughout the pandemic, challenges in terms of political instability and changes in the Ministry of Education, also the position of teachers' unions in terms of remaining in virtual modality until they all have been vaccinated or conditions in schools are improved. Limited data and information about WASH conditions in schools, apart from what was already available through the JMP. And then one of the main challenges in terms of the limited coordination at local level between sectors and local governments to actually take action in terms of what improvements needed to be made in the schools at local level. And in that context, we have been working with a three-pronged response: evidence to guide decision-making, advocacy to in two levels, one at political level, just to maintain the safe return to schools on the agenda, and then also technical level to ensure that especially local governments have the required information to guide their decisions, and then a comprehensive technical approach in which we have brought in interventions from different sectors, which I will talk about a little more in the next slide. Next. On evidence and advocacy, we have been collecting data on different fronts. We have conducted quarterly surveys about the impact of the COVID-19 pandemic on children, including a focus on the continuity of education and safe return to schools. We also have conducted the first national survey of WASH in schools jointly with the Ministry of Education and the National Water Authority. This was informed by the experience of the Ecuador country office using the COBO platform and with the support of CEST. And this has been tremendously important in terms of providing a more nuanced understanding of what are the needs of the different schools across the country. And very importantly, on the advocacy side, the activation of a WASH working group that also has allowed coordination of key actions, including joint trainings of humanitarian civil society partners and the articulation with the local water authorities. And lastly, but very important as well, joint advocacy with other agencies, the World Bank, UNESCO, and WHO's regional office for the Americas, in terms of maintaining the focus on safe return to schools as a key component of the overall response to the pandemic. Next. On the technical support and the comprehensive approach that we've taken, we have made a huge effort to ensure that our interventions are integrated and bringing together key actions in education, health, WASH, and communication for development, and working across three levels. One, to empower communities with key information, with the promotion of key practices and behaviors, and also working with local communities. Improving the WASH conditions in schools, where we have built hand washing facilities, we have provided basic supplies, and we also have promote key practices and behaviors, as I mentioned. And then in terms of the development of skills of principals and teachers to ensure that the return to schools is done with the best safe conditions possible. And on this front, I would like to highlight that the support that we have provided to the schools through the development of the national protocols and the operational guides has been tremendously important, because as I said earlier, the government gave decision-making power to local districts to make those decisions. And in that context, that training and that support has been tremendously valuable. But I think overall, the key message here is really the importance of working in an integrated manner and using every opportunity to talk about schools to actually highlight the importance of focusing on improving WASH conditions as a key component of a safe return to schools. Next.
You have 1 minute, Rafael.
Just on the challenges and opportunities, I will highlight three key issues here. The first one is to sustain the political will of authorities and society to fully reopen schools. And that will include an update of survey data about WASH conditions in schools. We would like to see where we are now compared to the data we collected several months ago. Second, to increase investments for sustained improvements of WASH conditions in schools at scale. It's clear to us that one-off interventions or one-off improvements will not suffice. Therefore, national governments and local governments have to make sustained investments to ensure that WASH conditions are optimal throughout the process of return over the next years. And lastly, very importantly to the work that we do in the country, to continue leveraging the participation of women, adolescents, and young people in this process. We have supported, for instance, the community network for precarious settlements, which has been tremendously valuable in promoting not only prevention of the COVID-19, but also the importance of returning to schools. The network of indigenous communicators has been working very actively in indigenous communities, including the promotion and socialization of the contextualized protocols and guides for schools in these communities. And then thousands of volunteers that have actually joined efforts at local level, and the recent launch of the U-Report platform that will allow us to actually engage more and more young people, not only to provide feedback on some of these interventions, but also to become themselves advocates for the improvement of the overall process of return to schools, including WASH conditions. So with that, I'll stop here. Some of the documents and reports and studies that I have mentioned are available to share with participants, and we will provide those to Pilar and colleagues for sharing through the different channels that will be available after the meeting. Thank you again.
All right, thank you so much, Rafael, for bringing us this experience, and very interesting to see how Paraguay has turned this crisis into an opportunity for better coordination. Let me take you now to Iraq and give the word to Hussein Al-Azawi, who is a WASH specialist at UNICEF's Iraq country office. And he's connected from Baghdad. Hussein, please tell us about this situation in Iraq.
First of all, thank you so much, Isabel, and good afternoon, good morning, colleagues from other countries. Basically, UNICEF usually is supporting the children of Iraq in different settings, and one of the main settings is the school throughout the country. Prior to the COVID pandemic, we are supporting the infrastructure, the improvement of WASH facilities. We are talking about the hardware component in parallel to the software component, the behavior change. The fact, if you go to the next slide, please. Next, thank you. So this is the fact and the challenges for the school children in our country. All these factors are affecting on the infrastructure of the WASH facilities and other components. The war, the displacement, the conflict, all these factors, you can see we are talking about 70% of the pre-primary and primary secondary schools are hosting around 11 million Iraqi students, and you can imagine the volume of the school children in our country, and we need to focus on them since they are the future leaders for our country, and they are the major agent of change as well. There are all those pupils are suffering from the environmental problems. We are talking about the climate change, the water scarcity in our country, and these figures were taken from the report from the ministry, our main counterpart, the Ministry of Health and Environment. It is the estimated school children, which comprising 52% of girls, are dropping out from school due to different reasons. One of the main reasons is the protection of the girls and the separation of the latrines in these learning spaces, and this applied to the social norms of the Iraqi people. The last point, and these are the main points, the last point that we are talking about, 50% of the school children, girls and boys, have inadequate drinking water and sanitation facilities. These reports and all these figures were taken from the Ministry of Health and Environment, and the report, the joint report from the WFP and REACH during 2019. Next slide, please. What UNICEF did, UNICEF Iraq country, in coordination under the guidance of the regional office, the MENA office, and in coordination with the WHO colleagues. These are our main pillars. The first one is the approach. How can we respond immediately in order to mitigate the impact of the shock among the Iraqi people are talking about the global impact and how to respond immediately to all these demands and significant needs through different settings. One of the main settings is the schools. Our objective is to conscious linkage between immediate COVID response and lasting changes to WASH policies, institutions, infrastructures, and behaviors at scale. Our stages, we have started our responding, the immediate response, and we are now currently rebuilding these WASH facilities with the different thinking and different let's say we are thinking out of the box. We are not only applying the traditional intervention, UNICEF intervention, based on the mentality of the donors and other factors. And the last one is the Imagine, which comprising of the hand hygiene in school settings. Our core dimensions, as you can see, the advocacy, the policy level, and the second one is the how to fill the significant gap in terms of the hand hygiene supplies and services to perform hand hygiene, drawing on evidence generation on the behavioral change, adaptation, and how to approach and respond in different ways through using the digitalized approaches on monitoring and social media and other components. And the last one, introduce innovative and sustainable products and behaviorals in school settings. Next slide, please. These are our areas of focus: the hygiene, IPC, and the ensure of continuity of the water and sanitation hygiene services. Unfortunately, the closure of school significantly affected, and this was one of the main challenges and till this moment, in order to support school children, not only the infrastructure, but also to promote and build their awareness around the hand hygiene and other behavioral change components. The next slide, please. Now, our approach is to focus and think in different way. One of the main successes for UNICEF during the past period that we have supported youth and adolescent people to create a sustainable job through manufacturing and assembling smart hand hygiene stations with key messages, talking key messages in order to attract school children when they come to school and perform their hand hygiene and make it as a habit rather than only practicing hand hygiene. The other factor is how to support the IDPs and Syrian refugees in camps with food pedal hand hygiene stations in order to perform and practice it through our implementing partners. The other thing that we are still supporting and providing the local produced hand sanitizer in coordination with the academic institutions in order to fill the significant demand in country. And as you all aware that at that time it was a global shortage in the demand in the supplies, and one of them is the hand sanitizer as well as the disinfectant for schools and the healthcare facilities. Next slide, please.
You have 1 minute, Hussein. Thank you.
Yeah. The digitalized approach, we are using our partnership with youth volunteers from medical background in order to support and to develop key messages on how to perform hand hygiene, how to mitigate and perform or apply for the infection prevention measures inside the school during the final exam, as well as the community. We are targeting school children not only inside the schools but also in community in order to prepare them to when they go back to school, they will have a very good understanding on how to perform hand hygiene and make it as a habit. And the other important thing, we have established prince and princess of hygiene in communities. Since they are not attending the school, we are talking about the school children, but in their homes, we are supporting them during the last year in order to perform the hand hygiene and other IPC measures using the protocol, the IPC protocol provided by the MENA office in order to be well prepared, to enable them well prepared when they come back to school. The next slide, please. We are now working on the IPC comprehensive survey for schools throughout the country in order to set a baseline data, to have a baseline data and generate the evidence on the status of the IPC measures and other factors in schools in order to support these schools based on the selection criteria. In addition to that, we are coordinating with the federal government with the different sector partners from different entities and ministries in order to draft and develop a roadmap for hand hygiene for all initiative in order to be endorsed. And after that, we can implement our the costed action plan. Next slide, please. The most important thing that we are coordinating with the private sector, youth private sectors, postgraduate engineers, in order to build and strengthen a monitoring and evaluation system focusing on the impact, minimize the impact of the climate change and other precaution IPC measures inside the schools in order to measure the monitor and measure the water loss, the water consumption, and minimize the carbon emission through adapting the solar or green energy instead of the traditional power grid from the national grid. Thank you so much, and over to you. And I'm ready if anyone has a question. Thank you.
Perfect. Thank you so much for that, Rafael and Hussein. Very interesting presentations, and for showing us that even in the most difficult circumstances, we need to make our best to ensure that WASH services protect the health, education, and human rights of girls and boys around the world. Now it is the turn of the audience to make some questions. So at the moment, I would like to invite you to use the chat in Pathable to ask any of your questions if you have one. So first, I'm going to start with one question. I'm going to address this to Rafael. So it will be, for education colleagues and ministries, the provision of WASH services may not have been a priority. On your experience, what would be a successful strategy to place WASH services higher in the education agenda? You have 2 minutes, Rafael, please.
Thank you, Isabel and colleagues. I will build on our experience, obviously, but also to say that as part of the overall design of our country program, we have been promoting an integrated approach to our technical support to the government. And what that means is that as we engage with different sectors, including education, we're trying to bring in other elements that are critical to improving the quality of services, whichever they are. So in this particular case, in terms of the return to schools, we have been very deliberate in terms of ensuring that when we speak about the return to schools, we're not just talking about getting children back into the classroom, but also making sure that various aspects of the overall school setting are addressed. And that includes WASH services, but also psychosocial protection, and also the engagement of the wider education community, including parents and families. So that's been a critical aspect of our learning in terms of maintaining WASH as a key aspect of the education agenda. The second dimension that I would like to highlight is data and evidence. As I explained in my presentation, that's been tremendously important. The example that I provided in terms of the sort of triangular cooperation, bringing in the experience of Ecuador, having the technical support from CEWI, has provided us with a very useful assessment in terms of WASH conditions in schools, which was not available before. And that has provided a very detailed understanding of the spectrum of needs in each school, as opposed to just having a very sort of a sort of focused or sort of a 2-3 data points regarding access to water or to certain services. The WASH assessment has given us the opportunity to be more focused in terms of how governments actually engage with local authorities to ensure that the proper interventions are actually addressing the specific needs of each school. And in terms of the advocacy at global level, at national level, then it has provided very useful data for the government and other actors to maintaining WASH on the agenda. So again, I would emphasize the importance of that integrated approach in terms of bringing together all these dimensions as part of the overall process of returning to schools, and then data and evidence to guide those discussions, both politically, but also technically at national and local levels.
All right, perfect. Thank you so much, Rafael, for this answer. I would like to pass the word to Alban, please, if you can answer the same question or add on to this.
So regarding school assessments, what has been developed at a regional level by the education section with WASH, but also with other sections, was like a checklist, so that school directors can evaluate their own schools' readiness for reopening, but also regarding several components that goes from the WASH services, but also the infection prevention and control, and also like a specific capacity building as well. But the checklist has also been developed at a different administrative level in the Ministry of Education, so that, for example, the subnational level can also check his readiness to support the schools, the school directors, and etc. And also we had developed a checklist at national level for the ministry, so that all the steps from national down to the school level can assess how they fulfill the basic criteria. Thank you.
All right, thank you so much, Alban. I think we have a couple of more minutes. I think I will take a question from the Pathable. I see there are many questions right now. I'll get the first one from Bella Mons. It says, has there been school readiness assessments, and can speakers provide some experience? I would like to address this question to Hussein, please, if you're there.
Yes, thank you, Isabel. Basically, we have in coordination with the WHO, as I mentioned earlier, and the Ministry of Health and Environment and the Ministry of Municipalities, in order to agree on the unique and familiar and unique questionnaire based on the JAP indicators, in order to implement the comprehensive assessment for all the schools throughout country. As I mentioned, now we are conducting the data collection through using the manpower from the local staff from Ministry of Health and Environment, in order to make it easier for us and get all the data and information from the schools.
Great, thank you so much, Hussein, for those insights. Unfortunately, we have run out of time, so we will not be answering more questions. However, we have taken good note of all your questions, and we'll be publishing in the following days, together with the PowerPoints, the presentations, and all the materials that we have mentioned in this session. So lastly, let me give the word to my colleague, Alejandro Jimenez. He's based in Stockholm. He's the director of the Water and Sanitation Department at CEST, who will be sharing with us his reflections from this colorful and insightful journey. Here I say goodbye to you all. It has been a pleasure to guide you through this journey. I hope that you have enjoyed it as much as I have, and enjoy the rest of the World Water Week 2021. See you soon. Alejandro, adelante.
Thank you very much, Isabel, and thank you, everyone. I think it has been a really fascinating session. But I would like to end by highlighting a few quick points in the minute I have left. First is that, yeah, we had an initial quite poor situation, and Irene has told us about that. And this was before COVID. But with COVID, we face kind of an existential threat. And it has been mentioned during the session that there is a risk of a lost generation of school children. And we know that the longer the children are without school, the more difficult it is for some of them to come back. So the danger is big. At the same time, the opportunity is also unique. No, it is an opportunity to get attention to schools and to WASH in schools at a pace and a scale that that has not happened before. No, so when we talk about reimagining schools, now we have to set the bar clearly that is no school without WASH. No, and now it's a time where this can be perhaps discussed seriously, as it has not been done in the last few decades, perhaps. So we have an opportunity. The other thing I would like to say is that we have to make sure that we understand the scale. The scale of the challenge is huge. Paraguay has 10,000 schools or education centers. Iraq has almost 30,000 in the example that we have been listening about. So that brings me to my third point, is like we need to have a stepwise approach. We won't be able to manage all these at the same time, but we need to be persistent in bringing this agenda forward and in bringing the necessary steps. And I would like to highlight from the examples, the cases that there is much going on. No, I want to underline this first national WASH in schools assessment in Paraguay ever, with the collaboration between education and and also the National Water Authority, and very impressive activities been happening also in Iraq. And I wanted to highlight that these all of them are based in trying to collect data, trying to bring the attention to what is the current situation of access, continuous monitoring, involvement of the community and particularly youth groups, with some also innovative practices, digital means in Iraq, also the U-report being set up in Paraguay. So I think there are very innovative things happening that will help to keep the attention to the problem of WASH in schools. But I want to also underline that it's also an opportunity to think about climate resilient services. And that's something that Iraq has highlighted, but also, and something I would like to draw more attention on, is that still many things have been happening, but as Alban mentioned, the support to WASH service delivery, the service delivery models, the operation and maintenance, how is this going to be sustained over time? How are we going to pay for it? Who is in charge for that? What is the role of the service providers? These things still are not adequately addressed, and this is a big challenge to the sustainability of the big efforts that are happening. So with that point of homework that we all need to keep pushing on, so that the services that will be built today and tomorrow can stand for a long time, I think I would like to conclude this session and thank you everyone, the organizers, the speakers from the different regions, and all of you, the participants, for being here. And I hope that we can continue in this journey together. Thank you very much and enjoy the rest of the World Water Week. Thank you.